Welcome to Global Biosecurity Law. Now we're going to talk about the incident involving SARS, an outbreak in 2003 that was the first pandemic of the millennium, and it was pretty scary. It was scary because we thought we had conquered these kinds of diseases, but no one could identify it. It started in China, and this showed us that we had a lot of gaps in our international law to address such a pandemic. Take a look at this graphic of the airplane that began the spread of SARS around the world. This shows you the index case as well as people who were affected. There isn't any real pattern here. It was pretty random. Some people were affected because they stood in the aisleway near the infected passenger. Some of them just got caught in the air circulation system on the aircraft. But as you can see, that infection was spread on the air travel plane in March 2003. Here's the number of new cases that developed. Notice that huge spike in March, which tends to be rather scary when you have a huge spike in cases. But that was also the time when China admitted that they actually had a problem, which may have just revealed more cases than we knew previously. But as you can see, it has a curve of diminishing by July, but it had two peaks, one in March, and then later, as you see, several weeks later from the transmission cycle. Here's a look at SARS by country in April 21, 2003. So we're still in the middle of this pandemic when we see this graphic. But already we have 3,800 cases worldwide, and that includes some in the United States. And as you can see, China is the one with the most, Hong Kong, and then Singapore. Here is a map that gives you a better picture, one look at where SARS traveled. And it traveled right along with the passengers who left infected from China. So I'd like for you to take a look at how China looked back on this 10 years later, and they give you a little bit of the background as well as what's happened.
It started like a regular cold for Mr. Lee in the spring of 2003, but soon he was experiencing severe pain.
聽到有一種病毒入侵，但係我住院嘅期間咧係威爾斯感染嗰班見習醫生係混埋一齊。
He spent 2 months in that coma. And with an influx of patients experiencing similar symptoms, scientists at Hong Kong's universities worked round the clock to identify what was causing it and how to treat it.
The difficulty is you don't know what you are treating at that time. All right? The patient having fever and the pneumonia, and we haven't found anything at that time. So everybody is very anxious, trying to find what is going on wrong with the patients.
The disease was eventually called SARS, Severe Acute Respiratory Syndrome, a virus that first spread in densely populated animal markets in southern China. In the spring of 2003, it was brought to Hong Kong by a visiting doctor, and within weeks, it spread throughout the city.
當時嚟講咧，即係淘大花園根本係一個死城一樣嘅，冇晒人嘅，根本上嚟講，完全鋪頭都唔開嘅，咁所以咧就好多人都唔敢嚟呢度嘅。
The Amoy Gardens private housing estate in Kowloon was one of the black spots for disease transmission.
成個期間咧，我哋有差唔多300幾人咧係受到感染啦。咁當時呢度嘅氣氛就好差啦，因為點解咧？政府冇話俾我聽，就嗰個來源係點樣啊？同埋嗰啲人咧入咗醫院之後咧，佢哋就嗰個情況咧就好差，即係變得好壞。咁啊好多人咧都發高燒，同埋咧就入咗呢個ICU。
In total, over 1,700 people in Hong Kong were infected, and nearly 300 people died. Many of the survivors still suffer from SARS long-term effects. Mr. Lee hasn't been able to work since he got ill.
後來出咗個幾月之後咧， 一路走去鍛鍊，去學行路，恢復我自己嘅體能。咁體能之後呢，突然間又發現骨枯，所以嗰個情緒好高漲，崩潰，精神崩潰。
In the years after SARS, the Hong Kong government has taken extensive measures to promote public hygiene, hoping to avert the next pandemic. But Professor Yun says it's only a matter of time.
SARS is horrible because it's acute, and also the mortality is around 10%. It will come back if you open up all the wildlife markets in China again, and you can see that things always repeat itself. If it comes many years later, all the vigilance will be gone, and the effect is much bigger. All the measures that we are now taking would be so downgraded that when it comes, we will not be able to handle it because of the loss of vigilance. But if it comes earlier, then it's usually easier because now we, at least in the public health sector, we are still very concerned about emerging infectious diseases.
So you can see from this video, it was a huge impact to China and Hong Kong and the entire Asian region. And it called for some changes, which we'll take a look at next. But let's talk about what the United States did immediately in response to that. The case, the origin of SARS was found to be zoonotic, that is, it jumped from animals to humans. And it was this animal that it jumped from, the civet. A civet is sort of a cat-like animal, but it was eaten and it was in the market in Guangdong. Guangdong is a very crowded market with lots of animals in cages that are eaten as delicacies in China, and the civet was one of them. So being in close proximity to the civet and eating the civet was the beginning of the virus. In response to that, the United States prevented the importation of civets and also prohibiting people from keeping them as pets. So the agency that managed this operation, you might be surprised, it was CDC, not state public health agencies, because the issue was importing civets and transferring civets, transporting them across state lines. So CDC issued the bulletin to prevent the transport of civets and importation. And that ban is still in effect. Now, why did China end up not being very responsive to the global community? Part of it is because of their decentralized nature. If you take a look at their organizational chart here, how their cities are organized, you'll see there is a very loose organization, even though they report to the central government and the Communist Committee. There are large cities that run their own city and don't really respond for other matters to China. So a lot could be going on in these cities that the main government of China would not know about, or the Communist Party, at least for some time. Here's the governmental administrative organization that gives you a little bit better picture of this. As you see, there's a special administrative region, which is Hong Kong, a special relationship. And then you have the city relationships, and they really operate very autonomously and, as we said, very decentralized. So it made it very hard to get information back and forth between the governments. In fact, it's very much managed even at the local level, and the cities may not be involved. For example, they manage problems in neighborhoods by having the elder grandmother, for example, in neighborhoods manage how people should behave to control the disaster. And that's pretty much what they did during the SARS outbreak, which helped in the neighborhoods. But this was not a neighborhood issue. This became a global issue and a huge embarrassment ultimately for China, who had tried to keep it secret until they could cure the disease. But once revealed in March 2003, they began taking measures in cooperation with the World Health Organization. As you can see here, they're taking temperature of transportation workers and railroad stewards in the entire country. There were a lot of political cartoons about China being very secretive, and their quarantine was actually keeping out help rather than solving the problem. As you see the Great Wall of China here acting as a barrier to the outside world to come in and help determine what it was that SARS actually was, this unknown virus. Another political cartoon with kind of a play on the mask that they were wearing, meaning they weren't talking about it either. And here, the attitude that SARS didn't exist was pervasive throughout China until they actually disclosed it. People in China responded by wearing masks in the streets, as you see. As you can see here, there was a number of deaths, and the death count and the infected count was rising just daily. And here's one report of what you might see during this outbreak in these countries. You might also note that coincidentally, Japan's Unit 731 was located in northeast China in the same region as Guangdong. There was no relationship at all to Unit 731. It turns out it was a civet, but it's interesting to note that it was in the same region. So though China has invested heavily in its capabilities to study and contain pandemics, the sudden growth in this sector has also opened serious gaps in biosecurity. So they began trying to study more and bring their own biosecurity research enterprise up to speed after SARS, and after not being able to determine what SARS was. It was actually CDC in the United States, in combination with Europe, that determined that SARS was a new coronavirus. And then they began to know how to address it and how to contain it and what it was related to, and to get to the source of it, which was the civet. But China began to build its enterprise in order to address this deficiency in their own system and not being able to identify these viruses. But in 2004, a batch of the SARS virus at the National Institute of Virology in Beijing, mistakenly thought to have been inactivated, was moved from a high-level storage container to a non-regulated lab where medical students were working on diarrheal diseases. The breach of security subsequently, unfortunately, resulted in 8 infections and 1 death, as well as the temporary closure of the institute and quarantine of over 700 individuals suspected of coming into contact with the virus. The problem was not a failure of equipment, technology, or insufficient regulations. Instead, it was simply a mistake of human negligence. And this was a report that China made in their dual-use report in 2008. The Chinese Academy of Sciences, for example, has published guidelines which state that scientists should, quote, exercise strict self-discipline and science morality and the style of study to become the examples of scientific and technical circles, end quote. There are no less than 53 government-sponsored regulations and laws pertaining to biosecurity and biosafety in China, the vast majority of which were passed after the SARS outbreak and incident. With 7 different government ministries publishing regulations and laws related to infectious disease, there is arguably a need for officials in Beijing to decide how best to streamline their system. Remember, this very deregulated system also has the lack of uniformity. The implementation of new biosecurity and biosafety regulations in China poses a number of challenges. New rules must be applied to the full range of laboratories that work with highly contagious infectious diseases. Yet, without a well-designed plan and resources to ensure effective oversight of practices at all levels in China, then the advances really are not going to be helpful. So better oversight is definitely needed in China to make all of the regulations coordinated. China's biosecurity law. To qualify to receive and handle human and animal pathogens on these reference lists that they have created, an institution must be legally established and have a laboratory certified to engage in experimental activity with highly pathogenic microorganisms, similar to our biosafety regulation. The receiving institution must also obtain approval from the particular government offices responsible for experimental activity with the highly pathogenic microorganisms, storage of microbial strains and samples, production of biological substances, or the other relevant activities. The third tier of the management and security system for highly pathogenic microorganisms in China is that culture collections and laboratories must receive an additional designation from the Ministry of Public Health and the Ministry of Agriculture to possess human and animal pathogens from risk groups 1 and 2. Risk groups 1 and 2 from WHO designations are the top 2 most infectious diseases of 1, 2, 3, and 4. In addition, the laboratories must also obtain approval for the conduct of experimental research with individual highly pathogenic microorganisms from these risk groups or microorganisms suspected of falling into these risk groups 1 and 2. And furthermore, the laboratories are to report to the public health or veterinary authorities above the provincial level for approval of shipments request for pathogens from the reference list. And we also, of course, that mirrors our regulation for managing shipments and transport across state lines. 3 separate additional approvals, in other words, are required to work with Group 1 and 2. So, in summary, China has an interesting history that started its modernization of its biosecurity and biosafety enterprise with the incident with SARS, which turned out to be a huge embarrassment for China, resulting in deaths from around the world. When China didn't report about the SARS virus, one of the problems was that we were still operating with the 1964 international health regulations, which really didn't make it mandatory for any country to report any outbreak at all. It was simply required to report a certain number of 6 to 8 diseases that had pretty much been eradicated. So when an unknown disease came along, there was absolutely no obligation for any country to report it. And that led to reconsidering what international health regulations meant, particularly the SARS outbreak in China. Now let's look how a common law country, Canada, responded to the SARS outbreak, both within their country and afterward.